is absent, wisdom cannot reveal itself, art cannot manifest, strength cannot fight, wealth becomes useless, and intelligence cannot be applied. Radio Life presents the Health Wave. Maximum information for making wise health and lifestyle decisions.
Good evening, Atlanta. Hello, America and the world. This is the Health Wave on Radio Life. My name is Victoria Barayev, and I'm happy to say hi to you again. Thank you for joining me in this segment. I have to tell you, this has been a very busy week, not just for the Health Wave, but I'm sure also for you too. Stress, how do we cope with it? It's very difficult for some of us. But because we've all experienced so much stress in the last week, I'd like to offer you to take a break and let's take 1 hour to enjoy this segment of the Health Wave. Especially that now you have a chance to win a special prize that we always raffle off in our program. And this time we've got a multifunction eye massager. As you can see, this wonderful beauty device that was presented by our sponsor, the sponsor who often sponsors our program, the Kingsway Medi-Spa and Wellness Center in Brooklyn, New York. Please visit Kingsway page on Facebook as well as their website and find out what kind of wonderful services they offer. They have everything from facials to massage to new hair removal system and much, much more. All you have to do to win this wonderful device is to start writing comments on our Facebook page, and you need to do it once in order to be able to enter into the contest. Of course, you can comment as many times as you want. You can ask questions, you can say something nice to us, say hello, and we'll be happy to hear from you as well as answer all of your questions. But now let's go back to where we began from. We were talking about stress and pressure of the modern life that we all get oppressed by. It creates so much physical, not just emotional stress, but all these emotional problems, they transform into the physical stress. And how do we cope with it? Think about it. Not everyone is able to come out of the stress clean and fresh, especially if we have pains and aches in the body, if we're not feeling well, if our health is not that strong. And then what do you hear? Just think about it. How many times a day do you hear, "Oh, I have a headache"? If it's not yourself, then you hear it from someone else, probably several times a day. Or something like this, you wake up in the morning and you say, "Oh my God, my back hurts, it's killing me." Or something like, "Oh, I didn't sleep well. My neck is not doing that well, I can't even turn it." How many times do we do it ourselves? Just think about it. In the last week, how many times have you said to yourself, "I have something hurts here or something hurts there"? And then we say, I need a good massage, or "I need to see a chiropractor." Right?
Absolutely.
So no wonder we've been receiving so many letters from you asking us about inviting a chiropractor, asking us to talk about this part of medical approach. And I've been thinking about it. Chiropractic is part of what's called complementary medical approach. And in the last year, we haven't talked about health from that standpoint. So we thought this would be a great idea, and we invited one of the most successful chiropractors in the city of Atlanta, Dr. Dmitry Sereda.
Thank you.
Meet him. Thank you so much for
show.
taking your time to be here tonight.
It's all right. It took a long drive, but it's worth it. I enjoyed being here.
Great. Thank you. You know, we have so many questions to you, and I'm sure our audience also as well, but I'm speaking on behalf of our audience. First of all, I wanted to ask you, what do you think about this labeling or categorizing chiropractic as complementary medical approach?
Well, I wouldn't call it complementary. I would call it alternative medicine. There's two different ways of looking at health. It's Western and Eastern medicine. So chiropractic falls between into alternative medicine, but in reality, chiropractic is over 100 years old. That really came through in America, and it was kind of labeled chiropractic in America, but the profession itself is goes way back, because chiropractic is nothing more than, actually it's a lot more on the scientific level than bone setting. And bone setting been around for many hundreds and thousands of years. It most likely goes back to Egyptian time. So we're looking at a different approach to a body, to a disease, or to a sickness. Medicine approaches, okay, body can be only cured by drugs or surgery. In our approach, well, body cannot handle the stress. That's why it's reacting this way. So chiropractic based on freeing up your body, freeing up your central nervous system from any, and peripheral nervous system from any misalignments, correct subluxations in the body. That's what we call them, that cause interruption of signal between your brain and most cells in your body.
So let me ask you this. When we have a back pain, we know to go to a chiropractor. Or when we have a neck pain, we go to a chiropractor. Do we really understand the meaning of chiropractic, or what do we need to know as a patient or as a consumer about chiropractic?
Well, in this time and age, it's all about educating yourself. It's finding a good chiropractor, obviously, is important. That will educate you correctly. What chiropractic is about, it's not only about cracking the back, it's returning your function into your body. So, again, do your research.
Do your research. That's right. I know that chiropractic is your calling, and I understood it from the very time I walked into your office. I have to say, I came to Dr. Sereda's office. I walked into there, and I was greeted by him, and immediately I saw so much, so much inspiration in his eyes, so much love about this profession, so young, energetic, and very, very inspirational about the way he talks about chiropractic, the way he does his business, the way he treats his patients was just amazing. So I knew immediately this is his calling. How did you find it?
I wouldn't say I found my calling, I said calling found me.
Okay. How did it happen?
Through different life events in my life, through coming across needing a surgery at 13 years old, recommending surgery at 13 years old back in Ukraine. But it obviously didn't happen, and I was basically cured by a bone setter that I believe set my life on track. Well, you see,
sort of.
We'll get into it. Chiropractic is that we get more of a scientific knowledge. We study the same books as medical doctors do, the same anatomy, physiology. We go through 2 years of body dissection in detail, learning every nerve, every muscle, every tendon, every organ in the body. Bone setting, it was passed from generation to generation with very little understanding of physiology, anatomy, and other neurology and other things.
They just knew it worked.
Exactly, but we go through diet courses, we go through chemistry, biology, physiology again, exercise physiology. So it's based more on a scientific level, the way you can explain what's going on with the body and see how it's going to respond with the chiropractic adjustment and what else you can do.
So you can't really practice doing the spine manipulations unless you have a license for it.
Well, absolutely.
Unless you go to school.
I wouldn't.
I really wanted to ask you. Just recently, I took my daughter to a family physician because she had problems with her spine, and I needed a referral to a chiropractor. So the minute I said the word chiropractor, I got this huge anger spurt from the doctor. He was not happy about me taking my daughter to a chiropractor. Then I realized that there is such a big opposition from the medical field, from the medical doctors towards chiropractic services. Why such?
Well, there's still, back 20 years ago, chiropractic was very unpopular, but it is becoming more popular every day. because chiropractors are co-managing certain diseases, certain conditions with medical doctors. It's more understanding between two professions, and it's coming in strong. But still, there are those individuals that I guess have not come across the benefits of chiropractic themselves in person. I think that's the biggest thing.
That's the biggest part of the skepticism.
Absolutely, absolutely.
But even the fact that now more and more insurances, they accept,
chiropractic has been accepted
service.
for the last 20 years by insurance companies, and as I said, it's because of the level of education the chiropractors go through.
By the way, how many years of schooling do
it
you
requires
have to?
undergraduate, and it's, I believe, 4 years of graduate school. Along with
It's a long
5
time.
different boards, which were very, very hard.
Now, can you say that there are certain things that differ chiropractic from the medical care? Like there are certain points. What's the main difference between the regular medical care and the chiropractic
Well,
care?
let's put it this way. I'll give you a couple examples. I've been in practice for a while. I have patients that were patients, now kids that are patients, and parents that are patients. As you experience chiropractic, you're starting to understand that, taking a pill is not the answer. It's not the only answer. In many cases, when your body is deficient in certain things, you might need a medication. But for example, if you have a inflammation in a joint that missing function in it because it's misaligned, a pill is not going to return it to normal function.
Well, we think it will. We go to the doctor.
Well, because most of the Americans, most of the world is grown up in medical cabinet, which is medical profession is highly lobbied by pharmaceutical companies. That's what drives all the advertising, and chiropractic is not lobbied by big pharmaceutical companies that can spend money on making it popular.
It goes very deep into the politics.
This is not the program to get into it.
Right. That's true. Well, I also heard an explanation from one chiropractor that chiropractic treats a person from the inside, from the inside to out.
Your health comes from within out, not from outside in.
Right. And the doctors do the opposite. So they give you a pill instead of a dressing.
Exactly.
I don't want to say about all doctors or the entire medical industry, but that's the mainstream.
I'll tell you the most common thing. You have a headache, right? Most people don't know other types of headaches. So chiropractic adjustments is very, very successful in curing a lot of headaches for that reason, because it's taking the stress out of your muscles in your neck, providing returning normal blood flow to the area of your skull, and even regulating, and sometimes we call it sacrooccipital pump, that pumps the cerebral spinal fluid inside of your spinal column.
Wow.
Oh, it goes deep.
It goes deep. So what type of ailments chiropractic can address?
As far as elements,
like we know neck
health.
pain, yeah.
Well, it's it how deep you want to go into. As I said, your spine, and which houses your central nervous system, essentially, serves as a main highway between the main computer in your body, which is brain, and the rest of your body, which is your car, your moving vehicle. So how well do you want to have that connection? It's up to you.
Let's say, can you go to a chiropractor as like to a family physician?
Absolutely.
Is that comparable?
Certain things we can check, certain things we should leave it to a family physician. But you should be checked in my understanding, once a month, once you have your spine under control. It's just like going to a dentist, getting a cleaning. Some people need it once every 3 months. Some people need it once every 6. The goal with every of my patients is basically getting back to as close as 100% as we can, and have them come in once a month to keep it that way.
So what type of health problems do you usually see, your patients
I deal
come
with
to you?
many different kind of conditions. I deal with regular sprains, strains, to correctional of the spinal postures, scoliosis, headaches, even, believe it or not, allergies, which is everything in the upper cervical region. I deal with shoulders, elbows, wrists, knees, ankles. Basically, if there's a joint and it's been connected by it's two bones connected by a joint and soft tissue, we deal with it.
So even allergies?
Even allergies.
Wow.
It's kind of a side effect of chiropractic care, because freeing up all the connections between all the sensors, all the cells in your body, and your central nervous system is really essential to your function of your body.
Well, I have to say it's such a nice side effect because so many people now suffer with allergies, especially now, the season of allergies.
Well, if it frees up the blood flow into your sinuses, it's going to help you. There's, again, allergies come from many places. It can be different things, but one of them can be coming from connection in your body.
Dear friends, I wanted to remind you that our special guest tonight is Dr. Dmitry Sereda, a chiropractor in Atlanta. Would you please say where people can find you?
We're located in Sandy Springs at 855 Mount Vernon Highway Northeast. That's Suite 100, Atlanta, Georgia.
And the phone number there?
770-394-1336. You can always check us out on atlantatotalwellness.com.
And you can also find Atlanta Total Wellness on Facebook, and you can always call for a free consultation anytime.
Yes, you can.
So now, guys, please keep commenting. We want to give you this multifunction eye massager at the end of the program. Write your comments, write your questions, write your hellos to us, and we are continuing lots and lots of questions to Dr. Dmitry. Dr. Dmitry, you just said about allergies. So I just wanted to let you know, guys, if you have allergies or you know someone that has allergies, keep in mind that even chiropractic care can help you. So it doesn't mean you have to get on the inhalers and nebulizers and so on. So there is something else that if you look at this issue from another angle, from a more of a holistic perspective, you can probably find a better answer. Which is, you know, it's very, very...
There's sinus adjustments as well, which are not allowed in the state of Georgia the way we like to do them, but...
Wow.
Yes.
Are they allowed in any state in the United States?
Yes. But again, going back to conditions that chiropractor can address, one of the things that I specialize in this decompression. Which many people suffer from, especially with today's technology that people spend most of the day sitting, watching their cell phones, watching their laptops, working on them. Car accidents, injuries bring those conditions up as well. Overall, changing of posture in today's age is very important, and how your body reacts to it, because the forces on the discs that located between the bones of your spine are changing as your posture changes, which are not designed to hold that stress. And that's why we see a lot of degenerative disc conditions, bulging disc, herniated discs in younger population these days.
So, you know, the disc problems are very, very common right now. So let's just reinforce once again, why do they happen? Is it because we don't move enough?
We don't move
physically?
enough. The way the discs stay healthy is by motion, because the disc's not supplied by any kind of nutrient supply. So they get all the nutrients, all the hydrations from the outside of the disc as they move. It creates a natural pump as they move, and it gets the nutrients into the disc. Once that function is altered, basically, it stops. The discs, I call it the disc stop breathing.
Is it reversible?
In many cases it is. In certain stages, there are further stages of degeneration that are pretty much, you have it, you're stuck with it. But many stages, many beginning stages are reversible.
What can we do to prevent this problem, not to get ourselves into that mess? I know people who have this problem. It's not fun.
You got to keep your core strong. You got to watch how you lift things. You got to watch how you do things every life. You got to be hydrated. Nutrition comes into the play. You got to start looking at your health again, within, inside out.
So you just have to live a healthy lifestyle. That's all I can
that's
say.
what.
So
These are
nutrition.
demands of this age, you know.
Exactly. Nutrition is part of it, big part of it, right?
Rest,
Hydration, movement,
decreasing
rest.
those stress levels. This is all comes together at the end of the day.
Correct. So you just mentioned you work with scoliosis. So let's talk about it. There is an approach, right now, if you go to a doctor, right, to a spine doctor, he'll tell you that scoliosis, in the most cases, is not reversible.
Depends what age the patient come in. Usually after 16 or 18 years of age, scoliosis are not really correctable. You get pretty much stuck with it, but what you need to worry about is maintaining it, not getting worse. So preventing from getting it worse is the key. Now, a lot of scoliosis will correct itself because they call functional scoliosis, because of the misalignments and how your body is reacting to the misalignment within your spine. Some scoliosis appear because somebody was born with a shorter leg, for example, and their pelvis and the hips are not balanced out, and in these cases appropriate measures should be taken.
Well, how often do children born with a shorter leg? I guess this is not
too
more of
often.
a common.
But again, kids break their legs, sometimes if they break a certain part of the bone, it might not grow as long, or be the overall length can be affected.
And so many children have scoliosis nowadays. Why? What's the main reason for it? Again, not having the right posture, or what is it?
Well, I want to bring the topic of when do you really receive a first stress to your spine?
When you're born.
There you go. See, you already knew the answer. When you're born, because the first stress you really go through is when you're born. My kids I have 2 kids, 2 girls. I love them to death. Both of them been checked. First one was checked within 2 hours as she was born.
Wow, by you?
Yes, and I wouldn't trust anybody else with my kids. And the second one was actually checked 2 days after. And because my first one was born with a torticollis head. It's a torticollis baby. Some babies are breached. And she was born with torticollis neck.
Or you mean like twisted neck?
Twisted neck. You put it to one side, it goes back to the other side. After one adjustment, her head straightened out in the next 5 minutes.
How often does it happen to babies?
Well, I don't check everybody who's been born.
But maybe statistically.
Statistically, I have to look it up. I'm not currently up to that.
So generally, you suggest that every baby should be checked by a chiropractor as upon being born.
There's an interesting question I've been always asked by certain people, some people. Doctor, am I your patient? I look at the patient. I said, can you turn around? Great. Do you have a spine? Yes, you're my patient.
Wow. So everyone who has a spine is a chiropractic
Well,
patient.
listen, do you go to a dentist?
Of course.
Yeah, everybody got teeth, right? There you go. Everybody goes to the dentist. It all depends how much you want to be in tune with your body.
So everyone should start prophylactic chiropractic care since birth.
I believe so.
How
Because
often?
your body is growing. So do you want your tree to go straight, or you want your tree to go crooked? Do you want your spine to go straight, or you want it possibly, maybe, not grow right?
I've been to Dr. Dmitry's office, and I had a service. I had adjustments done, and I have to tell you, it feels wonderful. It feels great. And I recommend you, if not going to Dr. Dmitry, then go to your chiropractor and get your adjustments on a regular basis. I wanted to ask you, what is the difference between osteopathic manipulation and chiropractic? Is there a difference?
There is a difference. Osteopathic manipulation, my understanding, is more of a gross manipulation, where everything is moving. Chiropractic adjustment is a precise adjustment of a segment in a precise location and a precise vector to correct it.
So it's a more detailed approach, you would say?
It's definitely more detailed. Obviously, there's different techniques in adjusting the spine. There's over 600 or 700 techniques of adjusting the spine.
Wow.
Oh yeah. I guess everybody's had an opinion. But in my opinion, it really matters the sequence that you adjust in.
Mm-hmm.
You have to get in tune with the person's spine, the person's central nervous system, and really understand what needs to be done first
Mm-hmm.
and next, and how it needs to be done with the confirmation within your nervous system.
Often we get confused when we go to the doctor with a back pain, let's say, and the doctor, but they feel that instead of referring you to a chiropractor, they refer you to physical therapy. What's either the difference between the two, or do they need to be done together?
Physical therapy, some physical therapists and some chiropractors do very similar things. We can't say we do physical therapy, we do physiological chiropractic
Mm-hmm.
therapeutics. But in some ways they are very similar. We use the same kind of modalities. We do exercises. We study exercise physiology, how to rehabilitate the muscles, how to strengthen the body. And we work with physical therapists very closely as well.
Mm-hmm. Do you offer physical therapy at your office?
We will offer some form of physiological therapeutics, yes.
Mm-hmm. When I went to Dr. Dmitry's office, I saw these huge, gigantic machines, corrective machines. They looked impressive. Can you tell us more about them?
As I mentioned previously, I do specialize in disc decompression. I do have 2 machines in my office. They're the only machines in the state of Georgia.
Mm-hmm.
I've been the only solo provider in the state of Georgia with a 3-dimensional decompression system for the last, I want to say, about 14 years.
Wow.
There's different machines, as I mentioned, that do decompression of the spine, but none of them what I have. And I've got into this decompression on the very first machines that were developed by VAGS, the Vertebral Axial Decompression company that invented the first decompression machines. And that was many, many years ago.
Wow.
That was over probably 20 years ago.
So those things you use just for people who have problems with discs?
They are designed to rehabilitate the disc.
Mm-hmm.
It's a heavy core physical therapy for the disc itself by pulling your body at the certain vectors with the certain resistance of your body in pounds, we count it. And with the logarithmical pull, it rehydrates your disc. Basically, we're trying to pump the disc on these machines to rehydrate it and to get it back to close to 100% of our function as we can.
So that helps to reduce inflammation?
Well, our bodies is amazing. You know that,
they
right?
Are, of course.
They don't read books, but they're smart,
but
right?
They know everything.
They know what's good for them, right?
Right.
So if we give our bodies a chance to heal, they will heal.
Mm-hmm.
You know, the Band-Aid doesn't heal, right? The body heals itself.
Now, what's the principle of these machines? What type of effect do they do on the body? You just explained decompress, but is there...
They pull you apart, basically.
They pull you apart. And that allows more circulation.
More circulation around the disc. They also, with the rotational pulls, because of structure of the disc, which composes of different fibers that overlay each other,
mm-hmm.
and then when the bulging of the disc or herniation of the disc happens, those fibers intertwine between each other and they form adhesions.
Mm-hmm.
My system helps untwine those fibers and break those adhesions where they start to move, and back to its molded place.
Mm-hmm. Reminding you again, our special guest is Dr. Dmitry Sereda from Atlanta Total Wellness, correct? So visit his office and call him at 770-394-1336 to book your free consultation or just to come and get your adjustment done. He's a wonderful chiropractor. I've had service done by him, and I have to tell you, it really, really helped me a lot.
Thank you.
Still have a few more questions to you. I don't know, we don't want to get too much into politics, right? But
nah, not on this show.
Not on this show. But still, you know, there is not a fact, there is something on the internet that I bumped into saying that there is occasionally
I know where you're going with
chiropractic
that.
adjustment can cause
all kinds of issues.
all kinds of issues.
Listen,
What
when
do
you
we
get your
say?
neck adjusted by a hairdresser, well, cracked by a hairdresser, yes. But if you have it properly adjusted by a knowledgeable chiropractor, you should not be afraid.
Mhm.
Again, yes, certain things can happen. You know, sometimes we hear the stories, okay, one story every 10 years, and they blow it out of proportion. But what they don't talk about, how many medical mistakes happen.
True.
I think there's a lot more going on with reactions to medications and overdosing, and with the epidemic going on with the pain pills these days that everybody's fighting. Chiropractic is really, really good alternative answer to getting off those medications.
Mm-hmm.
I have numerous patients that I got off of all kinds of pain pills, medications. Taking ibuprofen 3 times a day for 3 months does not do any good for your stomach, right?
It doesn't, no, not
Or
only.
your body.
It doesn't address the issue, the
It does
main
not
cause.
address the issue. And in a lot of cases, for example, just because I deal with more serious conditions in the spine than other chiropractors, sometimes an epidural shot for your pain, for bulging disc, only turns off that signal that lets you know you have pain.
Exactly.
You know, it's like driving a car on the highway and all of a sudden you have a red light because the oil is low, and you come to the gas station and they're out of oil, but they say, hey, it's okay, we'll just turn the light off. Keep driving.
Mm-hmm.
It's going to break down sooner or later.
So you don't
And that's
want
what I
this-
usually see with epidurals. They do work a lot of times they don't, but the problem is not solved. It's just kind of masked.
Mhm. So you don't want that signal from the brain to your organs and parts of the body be broken. Right?
Absolutely not.
Mm-hmm.
Because,
You have to
you
find
know,
the issue and fix it.
exactly.
Are there any contraindications to the chiropractic care in general?
In general, when it's done properly, I don't see any counterindications to chiropractic adjustment. You just need to find a certain technique that works for you.
Mm-hmm.
If you have osteoporosis, yes, you cannot do heavier techniques. If you're pregnant, you cannot do certain stuff. You can still get adjusted.
Mm-hmm.
Took my wife through 2 pregnancies.
Wow.
As well as many friends. So it's just finding the right technique for you would be the best.
Many women who have osteoporosis, they're told not to go to a chiropractor. So I would like for you to reinforce this again. Can a woman with osteoporosis come see a chiropractor?
Who does very light techniques, yes, absolutely. It helps with the functional component of your musculoskeletal system, which is basically the core of your body. So returning a normal function to your body essentially returns a normal function to your muscles, which moves the bones, right?
True. Okay, so I think some people that I personally know needed to hear that too.
It's as I said, it's certain probably late stages of osteoporosis would be counterindicated for certain type of adjustments. But overall, I would not see a problem. I see patients with osteoporosis, and they do benefit from
That's great.
chiropractic adjustment overall.
That's awesome. You know, even today when I was posting the announcement about our show on Facebook, I got comments from people. Oh, Dr. Dmitry, he's great. He makes miracles. He saved my life when I was near death. So, and I've heard this type of comments from your patients.
Oh, appreciate it. Thank you.
So can you tell us about some interesting cases maybe in your practice? Or maybe some difficult cases?
Recently, I had a woman came in. She's in mid-50s. Has been suffering with headache for the last 40 years.
Wow.
Probably
Migraines.
about 12, type of migraines.
Mm-hmm.
They call it type of migraines. And they will mix between irritation of the, again, nerves in your neck region, along with muscle spasm and referral pain into the head from those. She's pain-free, and once in a while she gets a headache, but she comes in, she knows something's out of alignment, we get it corrected, she goes home, no headache.
Wow. So any type of headache, you can come and
Not
see
any
if,
type.
but you can, at least you can come
You
and
can
see if it
definitely
can
try.
help you. You
Absolutely.
can definitely try. Allergies, you can come and try chiropractic
Again,
care.
certain things are not explainable by modern science why they work,
But they work.
but they work.
Now I'm trying to think about some conditions that people wouldn't even think to go to a chiropractor for that.
Well, for example, if your shoulder is hurting, you might have a starting a stage of frozen shoulder because your joint is misaligned. Because certain things, you slept wrong, you got stuck, you have adhesions formed, and this is the starting stage of frozen shoulder, which at that stage is really easily cured. But some people take medications, take shots, it progresses to worse condition. Have many friends who've gone that way.
But you would never think that something like allergy would be connected to a chiropractic, could be connected to a chiropractic adjustment. That's what I'm
Well,
trying to,
You know, if you look at the chart of all the nerves and where they go, it is very easily seen that the second cervical, third cervical nerves are penetrating straight back into the face. First one. And they innervate all the trigeminal nerves and all the nerves in the face, as well as sinuses.
What about stomach pain?
Stomach pain, I've had cases. I've had cases with constipation as well as non-function of the stomach. Again, stomach area is right over there. It's written where the nerves. This is not new. This is just dissection.
So everything
and where
comes
people
down.
dissected the bodies and they made a connection. Well, this nerve goes here, this nerve goes here, this nerve goes here. Well, if the nerve goes here, it can cause certain issues, obviously, with this organ.
Sure.
So by removing subluxation, which is a component which is interferes the transmission of the neurosignal between your brain and the organ and the body, basically, if it's interrupted, all kinds of malfunctions can happen.
Exactly. So our body is such an intricate system that we have to understand what it needs to work properly.
Exactly. How is important that connection between your microphone and the earphones?
Correct.
And the rest of computers. And there's no delays, right?
There shouldn't be any. Let's talk about chiropractic care during pregnancy. That's important.
Sure. Well, with pregnancy, as a woman goes to pregnancy, her posture is changing because of the weight distribution.
Right.
You guys sleep differently, 10, 20 pillows, you come up differently, you have to alter how you move. So certain ways, your hips get out of alignment, the neck gets out of alignment, certain things get stuck. With that, obviously, you're going to start experiencing pain, discomfort, muscle spasms. With that, certain things being introduced into your body by your body, like inflammatory factor, and that can go a long way when you're pregnant.
So one thing pulls the other one.
Exactly.
So then you should get chiropractic treatments all the way up to delivery.
I recommend definitely from 3 months on you should.
And then as soon as you deliver the baby, how soon
You
should
definitely should get to a chiropractor.
As soon as you deliver the baby, like
Well,
as
what
soon
happens?
as you can.
What happens? Your hips come apart. Do they always go back into
Not really.
the brace? Not really. Exactly. I had some women with misaligned pubic symphysis, which connects the pelvis in the front, that we had to correct. That it just did not go back and did not stay in place to have a normal function in that area. Or sacrum or hips or anything like that. Pelvis comes out. Again, going back to a different posture and different curvature in your spine is very important as well.
Yeah.
Now, not mentioning when you have a kid, you start carrying it on one hip.
Oh, that's true.
And that changes posture whole again.
Mm-hmm. Then you get a back pain.
You get a back pain.
Chronic.
I deal with those kind of patients every day.
All the time.
All the time.
Well, then you have to have 2 children and carry on both sides.
Well, then you're going to need to be at a chiropractor a lot more often because you have double the stress.
Oh, correct. Oh, my God. So what can you say to those people who go to bed at night and wake up with a back pain just because they didn't sleep the right way? Does it matter?
Start taking care of your spine.
So does it matter what type of pillow you use?
Of course it does. Of course it does.
The hardness
obviously,
of your mattress?
depending on your habits of sleeping, you need to find a comfortable pillow, appropriate pillow to your how you sleep, either side or back, or I don't recommend sleeping on the stomach.
I don't either.
No, it gets your neck out. For people with the low back conditions, this does not do good for their low backs as well. I say it's better sleep than not to sleep, because when you don't sleep, you don't heal, you don't rest. Adds more stress to the body and doesn't do you good.
So whether you choose hard bed and no pillow or pillow, as long as
it's better to sleep on a firm bed. With, again, depending on how you sleep, on the side or back, that depends on the type of pillow you're going to choose.
So whatever makes you feel more comfortable, but the firmer the bed, the better.
Well, I wouldn't sleep on the board, but yeah, the firm bed is good.
So even if you have scoliosis, that can definitely help.
Absolutely. Strengthening out your core, preventing it from getting worse, keeping your muscle tone, spinal alignment to as much as you can so it functions correctly. That's what's going to prevent it from getting worse.
That's great. So I really, really want to encourage you guys, if you haven't been seen by a chiropractor on a regular basis, just like you go to a dentist on a regular basis for teeth cleaning, please think about it and do so. It's important, not only for the health of your spine, but also for the health of the rest of the body. Will help you heal your ailments much, much quicker if you have them. And I think the time has come for me to ask you to give some words of wisdom to our audience.
Where's the wisdom? Well, let's put it this way. We all have teeth, right?
Right.
And if we have enough money, we can get new ones.
Correct.
But no matter how much money you have, you will never get a new spine.
True.
So you might as well take care of it 1,000 times more than your teeth.
Very true. I also remember one thing that I heard from you. We are as strong as
a weakest link. That correct. Yes.
I think this is one of your favorite sayings.
Yeah. Well, listen, I had big guys, bodybuilders come in, and they've been on the floor because of that neurological type of pain. So no matter how big and strong you are, if you got a type of issue and pain, it can put you out.
So gotta take care of our spine.
Gotta take care of our bodies.
Great. Well, I think now the time has come for us to ruffle off this wonderful multifunction eye massager. And I'm going to let Dr. Dmitry pull the number from here. I hope we have any comments. No? No comments.
And the number
no
is
comments.
10.
Number 10. I guess we don't have any comments. And the gift is not going to go to anybody this time. That's right? Okay. And we are going to finish the program then by saying that whatever problems you have, keep pushing. Keep getting to your goal. It's important. And always remember, the sun sets to rise again. Thank you so much for being with us. This was Dr. Dmitry Sereda from Atlanta Total Wellness, where you can call to make a free consultation or come visit him for a spinal adjustment, to get any other services. You can call 770-394-1336. And this was Victoria Barayev, as always, with you. We see you next week. Please stay with us. Stay on the wave of health. Good night.
And find
Thank you.
answers to your most bothering questions.